Before we start our presentation today, please allow us to firstly briefly introduce the history of Chang Gung Memorial Hospitals and share an inspiring story which occurred here. In the early 1970s, Taiwan celebrated a prosperous economy and a rapidly improving living standard. However, the quality of the medical practice lagged behind the increasing rise of the country's wealth. For the patients, there were many obstacles to finding hospitals in which they were able to receive quality diagnoses. The graduates from local medical schools had very limited options to continue their learning and training, whilst those who had studied and trained overseas couldn't find appropriate places to contribute their expertise. Mr. Wang Yongqing was the founder of the Formosa Plastic Group. His father, Mr. Linkou Chang Gung, passed away due to an acute abdominal condition. Later, Mr. Wang attempted to avoid the same tragedy happening to other families' loved ones, and because he appreciated deeply what Taiwan society had brought to him, he wished to contribute something in return. Mr. Wang donated his fortune to initiate a project of establishing a new hospital in 1973. After 3 years' preparation, Chang Gung Medical Foundation was formally established in December 1976. The hospital was established with a mission to improve medical standards, foster excellence in healthcare, provide patients with the best medical services, and for teaching and research functions. Founder Mr. Wang Yongqing's business motto, "A dollar saved is a dollar earned," has become the Chang Gung people's inherent motivation to save energy. Stories revealing our founder's frugal spirit are well known throughout our hospitals. For example, Mr. Wang was renowned for reusing a paper hand towel. He would fold it and put it into his pocket for reuse after it had dried. An envelope would be reused more than 30 times. Even an old disposable pen would be refilled with cartridge ink. Mr. Wang also had auto-sensor lighting systems installed in pantries which would automatically turn the lights off when people left the rooms. Our founder stressed that we should have a good spirit, awareness, and a good habit. The essence of his motto encapsulates the environmental protection and carbon reduction goals of Chang Gung Hospital. Linkou Chang Gung Memorial Hospital was established in 1976, the third branch after Taipei and Geelong. Linkou Chang Gung Memorial Hospital is located in Guishan Township of Taoyuan County. There are 5 buildings, including the medical building, finished in 1976, and the Children's Hospital finished in 1988. 2 new buildings, including the campus of Yongqing's cutting-edge medical service, are currently under construction. In the near future, there will be 2 new cutting-edge medical parks in Yongqing. The total number of our employees is 8,746. There are 3,704 beds in our hospital. The total floor area is over 375,000 square meters. Through our management policies, we have implemented energy-saving strategies and carbon emissions reductions. A. Respond to the government energy policy and actively participate in various activities. B. Procure energy-saving designs for new buildings and apply for the green building certifications of EEWH, which stands for Ecology, Energy Saving, Waste Reduction and Health, and LEED, which stands for Leadership in Energy and Environmental Design. C. Continue to promote energy saving and carbon reduction measures to ensure energy efficiency goals are achieved. It is necessary to have effective strategies for promoting energy conservation and carbon reduction. Therefore, we adopted a SWOT analysis method to evaluate the strengths, weaknesses, opportunities and threats. Based on this method, we established the process of implementing our goals and objectives. In addition to actively participating in the government energy saving and carbon reduction plans, we have also joined the Health Promotion Administration, Ministry of Health and Welfare's 2010 Build Environmentally Friendly Hospitals activity. We set our target to reduce 7% of the hospital's energy consumption by 2020. We also applied for green building certification. Our new parking lots were submitted for EEWH certification, and applications were submitted for 2 new parking EEWH National Green Building certifications. Chang Gung Proton Therapy Center applied for new buildings LEED-HC Platinum and EEWH Diamond class certifications. This timetable page demonstrates that setting up an energy reduction target is not only happening in the Linkou branch, other branches are working actively and are well structured too. This is our Energy Conservation Organisation chart. At the top is the decision-making committee. Each execution step within individual branches can be found in this chart. Now we will explain our actions and approaches. As to power, we pay attention to the new products in the market. After analysis, if the energy-saving products successfully reach our standard, we would immediately incorporate them into our hospitals. For example, the existing illumination system of PL and T8 lamps was replaced with a new generation of energy-efficient T5 LED lamps. A zoning plan was adopted to replace the old systems. This annual saving of electricity amounted to approximately 1.5 million kilowatt hours, amounting to a carbon reduction of 929 tonnes per year. We adopted green water saving products, namely adjustable water saving taps, automatic sensor faucets, 2-stage toilet flushers, and installed water saving devices into shower heads, etc. Water savings of approximately 511,000 cubic meters of water per year were achieved. Carbon reduction amounted to 99.5 tonnes per year. We installed new technologies and new equipment, such as replacing water-cooled compressors with air-cooled units to save water and electricity. We swapped oil-immersed transformers to fiberglass-type resin transformers to save electricity. In transformer rooms, we changed AH air supplies to heat pumps, to recycle waste heat to supply air conditioners, and to heat water for the school district. Reverse osmosis waste water recycling and irrigated lawns with water from the lake, together with the above-mentioned approach, resulted in 1,801,000 kilowatt hours of electricity being saved, and 2,253 tonnes of water saved per year. Oil savings from steam boiling reached 469 tonnes per year. The total amount of carbon reduction was 2,575.8 tonnes. Green procurement is very important to our work. From 2010 to 2013, total purchases of all types of green label products reached just over 107,260,000 NT dollars. As to how to reduce our waste, each and every unit in our hospital works together towards reaching our goal. In the case of cutlery reduction, firstly, we have adopted recyclable tableware for patients' meals. Secondly, we have adopted recyclable tableware for dining areas. Thirdly, $5 discounts are offered to employees who use recyclable tableware or are prepared to use their own tableware. Concerning biomedical waste reduction, we sterilize all biomedical waste first and then recycle it. We worked diligently to promote electronic medical records. We invested a considerable amount in information equipment. The result could be seen in the reduction of paper used, reduced electricity consumed by printers, reduced use of toners, and finally in reduced waste incineration. This annual cost saving reached over 3,368,000 NT dollars, whilst carbon reduction amounted to 46.8 tonnes. The Department of Medical Technology also contributed their efforts significantly. Clinical pathology attempted to find a way to reduce the amount of tubes and swabs they used. Firstly, they considered reducing the amount of unnecessary sampling and then decreased the size of specimen collection tubes. Through their efforts, the reduction of waste reached 1,148 kilograms per month. Namely, each year 13,700 kilos of waste can be saved. Public transport is a good method to help reduce carbon emissions. Chang Gung Memorial Hospital operates a transport company to offer patients, visitors and our staff point-to-point line connections and city transit under our work strategy. 8 routes depart from the Linkou branch and 4 of them are free services. MRT also offers convenient public transport. Taking MRT would also help to reduce the carbon emissions produced by cars. Providing low-carbon food not only increases carbon reduction but also benefits the maintenance of good health. We advised and assisted our vendors to provide meals with less oil, less salt, less seasoning and more high-fibre dishes. Increasing amounts of customers are choosing these healthier options. Highly developed urban areas are usually the most devoid of green plants. We cherish all possible opportunities to make our land green. By carrying out our green plan step by step, we have covered all but 1.4% of the hospital's land with green plants. Our hard work gradually has paid off. Performance and recommendations. Using 2007 as a baseline, in 2012, electricity and oil used in steam boilers reached a total annual saving of up to 7.14%, or 22,681 KLOE, kilolitres oil equivalent. Water saved was 19.98%, equal to 1,215,000 cubic metres. The total annual carbon reduction amounted to 4,778 tonnes. This is equal to the carbon absorption of New York's Central Park. Let us compare with other large domestic units in Taiwan. According to the data from the Ministry of Economic Affairs in 2006, our performance was much better than the average value and better even than the top 25%. We received recommendations from different departments and organisations due to our good work on water saving, energy saving and carbon reduction. We work together with governmental departments to organise seminars to provide others with useful information. The parking lot for the pathology building was certified as a green building from EEWH. The newly constructed parking lot for the rehabilitation building also qualifies as a candidate for a green building certificate. Chang Gung Proton Therapy Center reached the diamond status as an EEWH green building. Premium status was offered by LEEDHC USA, which credited the design and is reviewing the construction. We pursue innovation and transcendence. The aforementioned Green Building Certification of EEWH covers 4 categories, 9 indicators and 5 grade levels. LEED, or Leadership in Energy and Environmental Design, US, Green Building Council adopts 9 categories, 7 indicators and 4 grade levels. Chang Gung Proton Therapy Center, located in the campus of Yongqing Cutting Edge Medical Service, sets a self-requested target of reaching premium status of LEED classification. Installing noise walls in cooling towers, setting up an ice storage system, using host variable frequency for air conditioners, and swapping the air conditioning plumbing system, FC, to a duct system, VAV, have all assisted in the energy saving and carbon reduction at the campus of Yongqing Cutting Edge Medical Service. In addition, the campus of Yongqing's Cutting Edge Medical Service also adopted Siemens' Best Energy Monitoring System, replacing fixed frequency airboxes with variable frequency units, adopting non-mercury LEDs and using high-efficiency lighting systems. Energy-saving insulation materials were used in the building. We installed arrays of 60 kilowatt peak solar panels with an effective generating capacity accounting for 1% of the annual electricity consumption. Sewage wastewater treatment used a thin film biological treatment system through which a water recovery of up to 90% was reached. The Earth is our common home. Saving energy and reducing carbon require infinite effort. We are fully aware of the importance of carrying out our hard work. Our team is delighted to have your support and encouragement. It is our honour to share our experiences with you and attract more teams to participate in our work. Our only home, the Earth, desperately needs our protection. Thank you very much for your participation.